authors have no financial interest in this presentation. The following video is based on true events. Microkeratome flap making has evolved over a span of 2 decades. Yet, complications do occur. The following video is meant to spill out some secrets of microkeratome flap making. Every time a microkeratome passes over the eye, the heartbeat of a surgeon pounds as a successful LASIK surgery highly depends on a good architecture of the flap. A free flap is one of the most dreaded complications for a LASIK surgeon. This is when we have to make a decision to continue or to abandon the procedure. Let's rewind back in time to understand what went wrong. Let's go back to the basic principles of microkeratome flap making, which include patient factors and surgeon factors for a more successful, predictable, and less nerve-wracking experience for the patient as well as for the surgeon. To begin with, the most important step of MK flap making is, as we call, verbal anesthesia, which is a detailed elaboration of the entire process to the patient on table so that the patient remains calm.
कवरिंग है आईज विद द क्लॉथ, दोनों आँख खुला रख के सामने देखते रहना है. ठीक है, एकदम रिलैक्स रहिएगा. आपको ग्रीन लाइट की तरफ देखते रहना है. दर्द बिल्कुल नहीं होगा, हल्का सा वजन पता चलता है. ठीक है, सेंटर में आपको देखते रहना है. एकदम रिलैक्स रहिए, हाथ ऊपर नहीं लेना है. एक बार मेरी तरफ देखिएगा प्लीज, मेरी तरफ देखिए. वेरी नाइस, बहुत अच्छा कर रहे हो. लाइट में भी देखिए, हल्का सा आपको वजन पता चलेगा. दर्द बिल्कुल नहीं होता है इस ऑपरेशन में. ठीक है, जब वजन पता चलेगा तो ग्रीन लाइट चली जाएगी, तो घबराना नहीं है. परफेक्ट.
Step 2 is to look for deep-seated eyes with a narrow palpebral fissure. Microkeratome flap making becomes difficult in such cases, and PRK would be the right choice for such patients. One must select the right ring and stop based on the K1, K2 values for a successful microkeratome flap making. This can be done using the nomogram, which is available. It is important to check the vacuum and the functioning of the foot pedal along with the calibration of your microkeratome before starting the procedure. In case of a suction loss, stop the vacuum and redock, this time making sure that there is no suction loss. Time to forward back to our face. Since this was a free flap and not an incomplete flap, we decide to go ahead with the excimer laser ablation. The free flap is kept aside, the laser fires. Once this is done, we then give a thorough wash to clean away all the debris of the laser from the stromal bed. The preoperative marking here was a savior. This helps us to place the free flap aligning to the preoperative 2 marks It is important to place the flap in correct orientation with the epithelial side facing upwards. A good ironing of the flap is a must over here. However, we need to be careful not to displace the flap from the marks done preoperatively. We need to wait for 5 minutes for a good adherence of the flap. We can then place a bandage contact lens and again wait for few minutes